Let's look at HSV very quickly as a side point. Direct passage of herpes simplex virus occurs from a mother to a baby, and that's almost entirely during the mother's first outbreak of disease. In the majority of these cases, the mother is unaware that she has the disease. This can present in babies in three major types of illness: skin, eye, mouth disease, where the illness is limited to expression of virus on the skin, in the eyes, or around the mouth; or meningitis, where it's now gotten into the meninges, and this is very dangerous, or around the brain. They may also get an encephalitis. Or it could be disseminated, and they have multiple organ systems involved, from liver involvement to pneumonitis to what have you. So HSV disease in the neonate is important because although it's very, very rare, and in fact most of the time doesn't necessarily present with fever, but rather presents with hypothermia or seizure or profound irritability, it can present in the febrile infant. And the reason why we have to know about it is because it has a very negative outcome, although it's very rare. So, skin, eye, mouth disease, just limited to the skin, is 100% curable with acyclovir. But if we don't treat it, it may progress to more significant illness. So 62% will have a normal outcome with no therapy, but 40% will have an abnormal outcome. Among patients who receive acyclovir, there is no risk of death. These kids do great. But if they get no therapy, in that 38% or about 40% of cases, it may progress to more significant disease. Let's talk about those more significant diseases. Meningitis, with acyclovir, only 1/3 will end up normal. Brain damage and deafness is common. With no therapy, death or abnormal outcome is essentially ubiquitous. Again, with patients who get acyclovir, death is only in 6%, but look at this. Among patients who get no therapy, half will die. So we have to pick this illness up, and there's a fear that we may miss it in these febrile infants. And in disseminated disease, 83% will end up normal, and with no therapy, it would be very rare for them to end up normal. Again, a significant portion of those patients die. Disseminated disease tends to be early in infancy, and these children are very sick.